Hello, I'm Ruth Etches, nutritional therapist, functional medicine practitioner and specialist in brain health and mental well-being. Now, October is ADHD Awareness Month, and today I really wanted to dive into a topic which I think is incredibly important, which is ADHD and the impact on mental health. So let's just begin by reminding ourselves what exactly ADHD is. So ADHD stands for Attention Deficit Hyperactivity Disorder. And we know that it's not just about being hyperactive. It affects our ability to focus, to concentrate, and to regulate our emotions. And we know that ADHD is by far the most common of all neurodevelopmental conditions in children, impacting about 8 to 10% of school-aged children, and 40 to 60% of these continuing to experience some ADHD symptoms well into adulthood. What we do know, however, is that ADHD does not usually exist alone. It often brings with it a host of mental health comorbidities, including anxiety, depression, OCD, bipolar, sensory and auditory processing difficulties, and more. And this complex web of conditions can make it really challenging for those affected and the families of those affected, as the mental health consequences are often not really acknowledged or even ignored. Now, furthermore, there's a very clear connection between ADHD and hypersensitivity, particularly when it comes to sensory and emotional sensitivity, meaning that a person with ADHD may be a lot more sensitive to sounds, sights, textures, atmospheres, moods, other sensory input in their environment, as well as experiencing stronger emotional reactions and potentially leading to emotional overwhelm or overload as the cortisol, which is the stress hormone, really rises. Now, we know that the consequences of untreated ADHD are significant, with symptoms adversely affecting many aspects of life, not just academic achievement. It can have a really catastrophic impact on self-esteem, affecting family and social relationships, heightening involvement in risky behaviours, even criminal activity, dysregulated eating habits, occupational status, job performance, you name it. Even driving skills can be impaired. It's a condition that can really affect every aspect of life. Untreated ADHD, we know in adolescence, can lead to a much higher dropout rate from education, with 3 to 4 times higher rate of substance abuse, and an increased risk for young drivers with ADHD who have an incredible 2 to 4 times as many car accidents as their peers without ADHD, which is just staggering. Now, we know that over the years, the use of medication to manage ADHD has been skyrocketing, with about an 80% increase in these medications since 1999. And we also know that the medications can be a game changer for some individuals and really acting as a life jacket that keeps them afloat in a neurotypical world. However, we also have now a great deal of understanding and knowledge of the complex interplay of factors that cause and drive ADHD. Genetics, environmental, nutritional and neurochemical mechanisms which really are behind this pathology. And in the functional medicine world, we really aim to seek to identify biochemical balances behind a condition and create then a personalised approach that aims to rectify these imbalances. And if we can do this, then we can really facilitate the best possible outcome, maybe avoiding or reducing the need for medication, which invariably will often come with undesirable side effects. The uniqueness of ADHD and the various potential triggers and drivers really does require a personalised approach and a deep dive into a person's biochemistry, factoring in their ADHD symptoms as well as their wider mental health. And this can be where testing can be incredibly valuable. So we have the tools to assess various factors, but some of the most important ones that I'm going to talk about include, number 1, genetic pathways. So we can delve deep into the genetic variations that can really influence neurotransmitter synthesis, breakdown and utilization. And by identifying these variations, we can then tailor our interventions to an individual's specific genetic makeup. And we know that a large percentage, maybe up to 50% of ADHD is genetically mediated. Number 2, vitamin and mineral levels. Testing these levels can really help to uncover functional deficiencies or imbalances that can contribute to ADHD symptoms. And addressing these nutrient imbalances through diet and potentially supplementation can be vital for optimizing brain function. Number 3, food allergies and sensitivities. Incredibly, it's been found that people with ADHD are 7 times more likely to have a food allergy. And if these go undetected, then this can really perpetuate cognitive dysfunction. This is especially the case in children. And as well as allergies on top of that, many individuals may be sensitive to certain foods that exacerbate their symptoms. Comprehensive testing can really help to identify these triggers, allowing then for the right dietary adjustments. Number 4, dysbiosis in the gut, bacterial overgrowth. So the gut-brain connection is now very well established, and testing for dysbiosis and bacterial overgrowth in the gut is crucial, as imbalances in the gut microbiome can really significantly affect brain function. Certain bacteria can even have a profound impact on our dopamine pathways, which we know are really critical when it comes to thinking about ADHD. So testing can be fantastically valuable, and working with a practitioner to help to identify the root causes, drivers and biochemical imbalances in that ADHD picture. But I also wanted to leave you today with really some foundational strategies that can be really valuable to begin incorporating into your daily routine, either for yourself or your child. Balanced nutrition can have a profound impact on day-to-day function and cognition. Number 1, balanced micronutrients. So ensure that every meal and every snack include a balance of unrefined carbohydrates, so whole grains, protein and healthy fats. And this balance really can help to provide a steady release of energy throughout the day and avoid blood sugar crashes that can occur with carb-heavy meals. Eat at regular times if possible to help to regulate that blood sugar level and support stable energy throughout the day. Number 2, really linked with this one, is enjoy a protein-rich breakfast. So the breakfast is really the most important meal of the day when it comes to regulating blood sugar. And if you start the day with a protein-rich breakfast, this can help to balance blood sugar. Think about eggs, chia pudding, eggy almond pancakes, Greek yogurt, nutty, seedy, paleo granolas. Just avoid the cereals, the sugary foods, the white bread and the orange juice. Number 3, omega-3 fats. Include sources of omega-3 fats such as fatty fish, think salmon, mackerel, sardines, anchovies, flax seeds, walnuts, chia seeds. These fats are really important for brain health and have been found to be very important in nourishing a growing brain. Number 4, avoid food additives, ultra-processed foods, and really monitor sugar intake. In a recent study, it was found that ultra-processed foods makes up a whopping 65% of the average child's diet. These are foods our grandmother would not have recognised as foods, and many of them are unknown ingredients that can have a neurologically dysregulating or excitatory effect, affecting concentration. Steer clear of artificial food colourings, preservatives and additives. Many individuals with ADHD may be extra sensitive to these. And at the same time, look at minimising sugary snacks and drinks, as excess sugar, we know, can lead to these energy fluctuations and really impact concentration and behaviour. And look for hidden sugars as well as the obvious sources. Number 5, it goes without saying, but hydration. Staying adequately hydrated by drinking plenty of water throughout the day. We know that even a small amount of dehydration can really affect cognitive function. Avoid plastic water bottles that may contain bisphenol A or worse. This has been found in some studies to exacerbate and worsen ADHD. So get yourself a good stainless steel water bottle. Number 6, we're almost there. Limit the caffeine and the stimulants, and this includes those energy drinks. While caffeine can provide a little boost in focus, excess consumption can lead to jitteriness and really interfere with sleep. Keep caffeine intake in moderation. It can very much lead to these crashes and imbalances in concentration during the day. Number 7, monitor those food sensitivities. We've already touched on this, but be aware of any foods that might make those ADHD symptoms flare. Some individuals may also benefit by doing a targeted elimination diet, eliminating these potential trigger foods. And last but not least, do plan and prepare your meals. If you plan meals and snacks in advance to ensure you have nutritious options readily available, this will avoid you relying on fast food or unhealthy convenience foods when you're feeling hungry or shaky or jittery. And remember that dietary changes may not produce immediate results. It's more of a long game, and it's really important to consult with a healthcare or a nutritionist for more personalised and targeted guidance when it comes to diet and supplements that can be helpful for ADHD. So I hope that has been helpful and interesting and given you the big picture of the connection between ADHD and mental health, as well as some actionable steps that you can start taking today. So please like and subscribe if you'd like to hear more about a root cause functional medicine approach to brain health and mental well-being, and I will speak to you very soon.